President Trump is about to speak. Roughly, we're expecting him maybe an hour from now to unveil new deals aimed at cutting drug prices. At least 6 pharmaceutical companies are said to be ready to announce lower costs for certain prescription medications, and you can see them there. The president has already gotten Pfizer, Eli Lilly, AstraZeneca, and Novo Nordisk on board, but more will join today to help healthcare become more affordable. I will, elbow, some jawboning, some shoving is better than legislating.
Yeah, absolutely. And, President Trump is obviously sensitive to the affordability mantra. The Democrats have fully capitalized on that. It's not exactly fair that they did that, given that it was their fiscal reckless spending that caused our current predicament with inflation. Although at the peak of Biden administration in 2022, inflation was 9.1%. We have come down from that so significantly, but American people still feel it. They still feel like everything is too high, especially Gen Z. There's not a ton of patience for the big, beautiful bill to kick in, and we want it now. We want immediate relief, especially young people. There's just not a lot of waiting. But when it comes to what he's doing with drugs, I think it's welcome. I think it's awesome. Like you said, maybe it's quicker than legislating, Dagan. But prescription drugs, that only counts for a very small percentage of all healthcare spending. So if you really want to lower healthcare spending in this country, you actually have to look at hospitals and doctors' offices. There's so many other culprits besides drug prices. It's kind of a drop in the bucket, but it's better than nothing.
Have you ever been to an emergency room recently? Because I have. And do you know what you see? You see tons of illegal immigrants flooding the emergency room. People who are there legitimately, it takes hours to be treated by a doctor. You look back on Obamacare, what was the argument for it? The argument for it was to decrease the flood of people into emergency rooms, to give them some sort of health insurance so that they could go see a doctor properly and not take every small thing to the emergency room because they can't be refused to be treated there. They were trying to solve one problem with a plan that also had many problems within it. And then they opened the border and they created the same problem once again back in the emergency room. So the prescription drugs, to your point, is a piece of it, but it's not the whole story. And this debate, Congress went home, but this debate about what is going to happen to the Obamacare subsidies is, it continues, and we're left hanging out there. The president has said he's open to it. He had said 2 years. Now I'm hearing that they're talking about 3 years of continuing it. I realize that it's a very complex and complicated problem to solve, but I don't see how throwing subsidies for another 3 years at it is going to fix it. The system is broken. It's not working, and we're going to squander that money as well. So what I'd like to see the president and his administration do, and I know they're trying to do this with these savings accounts where they want to give you the money for your insurance option versus giving it having the insurance companies have such a big third-party sort of hand in it. But I still am not sure 100% how that would work. And so until they come up with a solution to fix the actual fundamental problems in the system, we're just going to continue to go down this road. And yeah, you'll get a little token here and a little token there.
Do you know who pays? So, again, the undocumented immigrants in the emergency rooms, it wouldn't be as much of a problem if the border hadn't been wide open for 4 years. But you know who pays? Medicaid. Again, partially funded by the states and the federal government. Undocumented migrants are not supposed to get any sort of, broadly speaking, health aid from the government. But they are under emergency Medicaid covered if they would otherwise qualify for Medicaid. This is federally mandated. They're not supposed to get Medicaid, but they do because this is the burden. This is the burden of illegal immigration. Go ahead, Brian.
Well, but also it's just the sprawlingness of Medicaid and the sprawlingness. So this drug thing. I think it's good news, but it feels to me, maybe I'm wrong, it feels like winning a battle while you're losing the war. Okay, so you win a battle and you get lower drug prices, and that's good for a moment. And for those it affects, and I don't even know how much these particular deals affect everyone who's using prescription drugs. But then in Congress, you have the thing where Republicans, they don't even seem to care about the plan they're putting together. They've got these plans. It's like half-hearted interest. They can't even get a majority. They got a majority in the House. They're never going to get one in the Senate. And you can read the writing on the wall. Obamacare, supersized, extra, COVID-era emergency subsidies are going to get extended for a year, 2, 3, I don't know, maybe 3 years. And my view is, and somebody disabused me of this notion, but I bet you can't. My view is when they extend it for a year or 2 or 3, they're extending it forever because the same people are going to be there next time and they're going to do the exact same thing. So I kind of wish, as much as I like a win on drugs, if we're going to do this, I kind of wish that we try, like conservatives, people who believe in markets, would try to win the war and not win a battle that's part of a losing war. But tell me I'm too pessimistic.
Maybe this is the first battle.
Okay.
So we got to fight one battle at a time, right? You take it a day at a time.
Okay.
Love that. I actually thought that you were going to tell me that you didn't like this, and I was going to kind of be ready to fight you. Jackie, you and I
fight later.
No, Brian, I would never fight you. You would just crush me.
Oh, that's not true.
Jackie, we've talked about how I'm sick of subsidizing. Yes, I'm typically, right, a libertarian, a conservative would say, charge the market rate because I want these companies to make a lot of profits. They can invest in R&D, come up with incredible new technology, new medicines.
You're talking drug makers.
Yeah. Except that then we're subsidizing that when the rest of the world gets them for a half or a quarter of the price. And I'm kind of sick of that price. So I'm all for capping the drug prices or, negotiating with them or whatnot because I'm done subsidizing the rest of the world. Two things. HSA, well, let me start with concierge healthcare because my worry with the Medicaid conversation is it's pushing a lot of people into this concierge.
It is.
We're talking the upper.
It's the only way to get service now.
Yes, so I looked into it, totally unaffordable, not doing it. But my husband thought for a family of 4, if you can have this concierge doctor come to your home and you avoid all of that mess that you both just described, what is that worth? Now, totally unaffordable, but it's something that upper middle class people are starting to really think about because they're sick of walking into the mess that you just described. HSA, quickly, I really like that idea because it goes personal back into my pocket, into my HSA card versus down to the bottom line of the healthcare company. We were talking about technology the last block. I saw this hack come up on my algorithm, and I want to see if you guys like it. For now, I believe HSA doesn't have a time limit on when I can reimburse myself for a receipt. So I could treat my HSA as like an IRA.
Oh, I
Let
see.
it compound over time. So my like $50 here and there becomes, let's say, $5,000. And then I can reimburse myself for those receipts 20 years from now. And I have this huge net worth all trapped in my HSA that I can start to pay myself back into. So you could treat it as a way to compound money in the future.
I like the idea. I just think that if there is no time limit, they will certainly put one on. I just ran into an insurance issue where New York, not shockingly, has the most restrictive days for number of days for submitting claims than any other state. Most states, some states are 180, some states give you an entire year.
Yeah.
New York is 120 days, and then they'll deny it. So I'm guessing whether it's a state issue or a larger issue, they'll put some limits in to make sure you can't do that.
I would lose all my receipts in 20 years.
Krista wouldn't.
You're right. That's my only.
Gotcha.
I have an HSA and I love it.
File cabinet.
What?
He should get her a file cabinet.
I'd have room for a file cabinet.
Yeah, the funds roll over indefinitely and remain yours even if you change jobs or health plans. And there are contributions from your employer. But again, it's a morass because of the way the entire health industry, the health insurance industry is structured, that it's what ultimately you want to avoid is you want transparency in the pricing. I sound like a politician, but you want to know what a doctor charges, what the costs are, empower the individual. We've been talking about this as long as I've been in the workforce, but you just don't know. And you don't want this bifurcation of where you've got people who are on the Medicaid expansion for Obamacare, and that coverage sucks, and it's siphoning money, taxpayer money, to enrich the health insurance companies, and then a tier of the population who are just like, screw all of it. I'm just going to take the money I earn and go and just pay out of pocket for all of these health services, which in New York you have to, because the best doctors don't even take insurance.
No, they don't.